So today's going to run in a bit of a different way. Arya is going to give just a brief talk around the 5 A's. And then we're going to try out, for the first time ever, a card game. So it's a conversations card game around different steps of the 5 A's. Those conversations, there's no expectation. If you feel uncomfortable participating, then feel free to just sit back.
How's it going?
It's great. It's light out. It's light out.
Okay, so how many of you are actively using the 5 A's sort of approach? Bits and pieces of it? Bits and pieces? Yeah, what pieces are you finding?
Well, actually asking if people want to talk about their weight.
Yeah. Are you finding that? What's been your experience?
Well, actually, most of my clients, when they come, really do want to talk about their weight.
Okay.
And,
Do they bring it up or do you bring it up?
well, depending, because I'll usually open up and say, well, okay, what's up? And what's going on? And, well, my doctor sent me here and wanted me to talk to you. Okay, do you mind if we talk about your weight or your blood pressure or your diabetes? What is it that you wanted to talk about?
Okay. Have you ever felt any sense of pushback?
Only with one client.
With one client?
Yeah.
Can you do it?
Well, he suggested very strongly that I wouldn't know anything about weight because I was carrying extra weight myself.
Okay. All right. We also have the opposite, like what would you know about weight because you're skinny?
Yeah.
It works both ways.
Yeah, I said, well, just because I said I know a lot about weight, I have personal experience, but I also have a lot of education.
Yeah, it works both ways. Right? I mean, to the opposite response, you're skinny. What do you know about weight? I say you don't have to have cancer to be an oncologist, right? It's
Yeah.
So you're finding that helpful. Anybody else? What's been your experience with the Ask? Is anybody else using the Ask? Yeah. What's your experience?
Usually sometimes I just bring it up right away that I want to lose weight.
Mm-hmm.
And then sometimes I just say, do you want to talk about your weight? Are you comfortable talking about your weight today? And then they say yes. Most of the time everyone said yes.
Okay.
Everything else.
So that's the Ask. Has anybody encountered any actual difficulties at the Ask stage, or feels uncomfortable, or doesn't always start the conversation, or receive pushback that you don't feel comfortable handling? No? Okay, good. So then comes the next one is the Assess stage. And has anything changed in your practice through the Assess stage? Is there anything that you're doing now that you were not doing 2 months ago? Or 3 months ago before you started? Any change at all?
Last week the topic dealt with perceptions of food from a cultural perspective. And I just know from some of the group discussion, people thought, there was a real aha, I've never thought that the way some cultures think about food may be different than what we are generally providing information around.
And how are you going to translate that into your actual practice?
Well, for me personally, that will be very difficult, but I think along with the ask, it might be to ask about, can you just tell me a little bit about some of the food habits that are very, I would say, near and dear to you in your home?
Yeah, technically, you'd already be moving into an assess, right? You already started to assess something. So, but yeah, that's important. So long as you get out of the milieu, right? I mean, anything else? Any other changes?
I would say I'm looking more now for the root cause.
Yeah. How do you do that? What's your thought process when you?
Just throughout the assessment, and lots of times they know, and they'll say, I used to be a really physical job, and now I sit at a desk. But then I'll talk about, has that been looked at, or has that been dealt with, or?
Okay. And has that changed the way that you would then, interact with the patient or give them advice? Have you had any aha moments or insight moments since you've been using that approach?
I should write them down. I probably have aha moments a lot, but I don't necessarily remember them.
Okay. Anyone else? Anything else about the assessment? Are you feeling starting to feel comfortable with the obesity stage thing? Stage 1, 2, 3, 4. Okay. Anything else I want to assess that's?
Actually, I've been adding more of that into when I do my prenatals.
Okay.
And
That's interesting.
trying to find out what their weights were before they were pregnant and looking at and having a bit more of a discussion on expected weight gain
Yeah.
and that kind of thing.
You should check out my blog today. There's a guest post by someone who actually works in this weight gain. Okay, so moving on, in the advice phase, are you finding that you've changed anything in the way that you give advice or how you approach the advice part? Is there anything new in the advice that you give now?
I find I'm taking a lot more time to kind of, well, first of all, I identify like what are your motivators instead of what are your barriers this time, kind of switch it to a more positive. And then I also go a lot more into like the other factors when it comes to weight, like lack of sleep and stress. So I kind of explain some of those processes a lot more now.
Okay, well, and what's been your experience in response to it?
They're super receptive to it.
Are they open to that?
Yeah. Mm-hmm.
Okay. Well, why do you think that is? Why do you think that's different to what you were doing before?
I'm not even really sure. Just, I don't know, it's just kind of a new take for me, but it's been working pretty well.
Okay. Has anybody else experienced anything similar?
I've been talking a bit more with my patients about replacing an activity with something enjoyable. It's not eating, and I wasn't doing that before, and it kind of seemed to switch light bulb off in people's heads. So yeah, I enjoy eating. I gotta switch it up with something that I enjoy doing, like reading or calling a friend, exercising, those types of things. So.
And have you had a specific response? Can you remember something?
A lot of people say they have no idea what they like doing. So
There you go.
I'm like, oh, that's your homework for next time.
That's you bring in the recreational therapist. That's what they do. Yeah, no, seriously. Okay. All right, and then comes the part that I find the most challenging, which is the agree part, right? What's been your experience in trying to come in agreement on where you want? Talking about weight loss expectations.
People are reluctant to write their goals actually down, I find.
Yeah?
You know, and I say if you write it down, it makes it more real to you. You know, so I emphasize that each time I meet them, but
What
some do and
what
some
kind of
don't.
pushback do you get? What do they say when?
Yeah, oh well, I just, you know, I'll do it, but I don't have, you know, but I don't actually do it.
They don't actually do it. So have you had what's been your feedback and experience trying to move away from weight goals to behavior goals?
I just take away, I don't even look at the number on the scale
Okay.
anymore. We're, you know, emphasizing other things. And it's been very positive.
Yeah?
Yeah.
Is anybody else experiencing that? And trying to shift the conversation from weight goals to actual behavior goals?
I think it depends on the patient. Sometimes you get the patient say, I need to lose 50 pounds
Mhm.
for my daughter's wedding.
Right.
You know, by June. And so it's really challenging to get them to look more at the health benefits and spending more time talking about the negative aspects of doing that aggressive weight loss. But for ones that you talk to and say, you know, weight's not, you know, it's a poor indicator of health, and talk more about the health issues, I see a lot of relief in some patients.
So what do you do with the patients who are actually, they have these numbers in their head, so I have to lose 50 pounds, otherwise, you know, my daughter's wedding, I need a new hip, my doctor told me, whatever.
It's ingrained by the doctor, that number.
It's ingrained by the doctor. Well, what do you do? How do you do that conversation? I mean, like,
I'm
what do you
trying
do
to
with
work on the doctors and say, don't tell them to lose 50 pounds. You
that?
know?
Yeah, but what if the doctor says, oh, they have to, and then the patient comes in, oh, my doctor said,
It's constant repetition of getting them onto other, you know, other things other than that number. Trying to set goals and yes, I'm going to do an extra activity that's not eating for enjoyment.
How often do you experience the problem when you have patients who've either already lost weight on their own or have actually done quite well and the weight is down, I don't know, 5%, 10%, whatever, and then they kind of get stuck and they're nowhere close to where they want to go.
I stress maintenance.
And then they get really upset. This is not working, and I don't know why I'm coming here because really there's nothing happening and my weight's not moving. Do you experience folks like that?
Yeah.
Or you don't see them long enough?
No, we see them.
Yeah.
They talk about best weight a lot.
Yeah, so
Mhm.
if you've made the changes and you're enjoying that, and if any further changes, you know, if you look at the food and you've made all the changes, you're happy, and there's nothing you can really think you want to change more in some physical activity, then that may be your best weight because you're enjoying the changes that you've made.
And how accepted, how accepting
A
are
mix.
patients to that idea?
Yeah, a mix of them are. A lot of them think that makes sense. And some of them say for now, and then maybe down the road they'll be ready for more change later. So then it's maintenance for a little bit, and then see what you can change down the road.
Yeah.
I mean, we have that conversation about the expectations and why it's difficult to lose weight and maintain that loss. And we're always, you know, positive about the fact that they're not gaining, that they're maintaining. And you just have that dialogue, and they're still frustrated because they still want to lose, you know, 20, 30, whatever their number in their head is. And we just talk about it, like, openly. That I understand that that's your goal, and that this is kind of the realistic or reality of it.
Anyone else have something to that conversation? When it comes up?
I write down their labs if they agree, like even if they don't, like, I tell them a success, if they've maintained their weight or lost weight, and then write down all the positives of what they've done so far, and try and focus on that.
So when people hit the weight loss plateau, or when people come in and they say, okay, I've reached this point and really there's not much happening in my weight, well, what's your thought process when you think about it and say, okay, well, is there something that's more that this patient can do, or are they really at their best weight? How do you go through that thought process, and how do you decide whether someone is at their best weight or close to their best weight? Well, what are your criteria?
I guess I would look also at how much they've weighed in the last few years, or what's their lowest weight been. And
What does best weight depend on? I mean, what's the definition of best weight?
Is the least you can eat, the most you can exercise, with the lifestyle you can enjoy.
Exactly. So it's about behaviors, right? And so to find out whether somebody is close to their best weight, really the focus has to be on behavior. So how much are you doing now? And could you possibly do more? Right? So what often happens when patients is stuck somewhere and they've lost 20 pounds or whatever they had in mind, and they really want to go beyond that. There's only the real question is there more they could possibly do? Right? And that's the conversation that you really want to have with the patients. Okay, here's all the stuff you're doing. How many hours of exercise you're keeping your records, how many calories you're eating. Very often comes down to the calorie question, because patients are keeping good food records or are deliberately telling you what they eat. What you often find is that as the weight comes lower and lower, they eat fewer and fewer calories. And you very often then reach the limit of where you say, okay, I don't see how you could possibly eat less. And for a lot of patients also, we would say, I don't possibly see how you could be more active, because you're already doing all this stuff. And that's then really the conversation. Yeah, but there must be something else I can do. I said, well, not with real food. You know, if you eat any less, you're going to start having problems. So we have to then start talking about, meal replacements, and I don't know, do you want to give up food and go on shakes or whatever, but you have to stay on them to keep the weight off. Is that really what you want to do? Or you're going to have to start thinking about bariatric surgery. Is that what you want to do? Right? Or you're going to have to start training for Ironman competitions. Is that what you want to do? Right? So you have to give them on the plate that they've kind of reached the limit of what is physically possible for them. Unless they want to go nuts. Well, I call that going nuts, right? Unless you really want to make this your life's content. And that's and they're always looking for that little thing that you can probably add to what they're doing that is going to give them the big bang. Right? But there must be something. Again, isn't there a supplement I can take? Isn't there a certain type of exercise I can do? Or isn't there something, can I not eat even less? And the reality is, if you're eating 1,400 calories, no, there's not. But that's it. We've kind of hit that rock bottom. And I mean, that's usually when you have open the conversation about other treatments to see, okay, what can we do on top of this? And usually there isn't. Now, what you do have sometimes, do any of you do calorimetry, measuring actual calorie? You guys don't do it, right? So we do this in our clinic, and we brought it in for that exact purpose of people who actually get stuck. So patients who come in and they say, you know what, my weight's not budging. Can I not eat even less, or can I not eat right now? When you then actually measure the caloric expenditure, which is a little tube that we blow into, it's in a chair and blow into the tube, you can get a fair estimate of what they need. There's formulas and stuff, and you can measure it, and then you find out that these patients have an estimated caloric need of 1,100, 1,500 calories, 1,600 calories, which is not a lot. And that's what they're eating. So you say, okay, see, that's why it's not moving. And to move more, you'd have to further cut down on what you're eating. And it's going to be hungry, it's going to be good. So it's just realistically not possible. And it's not a very nice message, because in some ways it's very similar to telling patients that they have a diagnosis that they don't want to hear. They're going to have to go on dialysis. Right. Sorry, we don't really have a treatment for breast cancer. Right? It's not good. Well, that's not how you're going to say it. But the situation is the same. Right? You're moving into a situation where you don't have good news for your patient. Or at least they don't perceive it as good news. In fact, they might perceive it as very, very disappointing. But that is the reality, because it's going to be hard to move beyond that. And so keeping a positive note on this is, again, I mean, how many of you have worked in places like, I don't know, oncology and nephrology and other places like that? Right? That's exactly where you have those common views. You still try to look at the bright side, right? You always look for those little things that are actually better and good and looking nice. And that's kind of where you focus information on. But you're not going to be able to move against it. So if you have a 55-year-old woman who's lost 20 pounds and she's now eating 1,500 calories and she goes to curls 4 times a week, and she wants to lose another 20 pounds, it's not going to happen. At least not with that effort. Right? You should now be looking at, I don't know, curves 7 times a week and further cutting down to 1,200 calories and maybe even more. Right? It's just not going to happen. That's the reality of weight management. Right? And that makes it even more important to not focus on weight. That's the whole philosophy of not focus on weight, is because weight loss is going to hit a plateau. It's not going to go beyond that. And the good news in that, and I was just explaining this to a couple of medical residents yesterday, was that when you look at weight loss from a clinical perspective, weight loss is going to plateau. Right? Nobody's going to keep losing weight till they disappear. That just won't happen. So this is the easy part. This is like in Weight Watchers. This is where everybody gets excited. But this is where you show up for your weekly visits, and then you get on your scale, and everybody claps, and everybody's having a party because you've lost another 2 pounds. And life is great, right? And then you come to this phase where you're still going to meetings, and you're still doing everything, and you're still trying hard, and you show up for your weekly visit, and nothing happens on the scale. Right? And nobody actually pays any attention to you, especially with Weight Watchers, because they have ridiculous weight loss goals. Right? Their goal is over here somewhere, some made-up number that they have, and you're nowhere close to that. Right? And that's where. Have you heard this from people who go to Weight Watchers? Weight Watchers is a typical program where that happens, where they have these weight goals, which are, like I said, they're made-up numbers. You don't get anywhere close. You hit a plateau. You're still going for your weekly meetings. There's no new information coming at those meetings, because you can probably already write a book on diet and exercise. Nobody's clapping or cheering for you. You're probably working even at this level. You might probably actually be working harder than any other people. You know, I always say, you know, running 5 kilometers might help you lose weight, but to keep it off, you have to run 10. By the way, it's true. Right? If anybody has a question about that, we can talk about biology of why you have to do so much more work to actually keep the weight off than to lose it. So this part is the easy part. Everybody's very happy, and then you hit the plateau. Oh, it will always happen. It will happen in every patient. Sooner or later, they're going to hit a plateau. It does not continue. The good news is that almost everything else keeps getting better. Like even after, if you're exercising regularly, even once you've hit that plateau and your weight is not going down anymore, right? If you look at your sort of your quality of life kind of thing, right? That keeps going up. That doesn't plateau. But your blood pressure keeps getting better, your energy levels keep getting better, your self-esteem keeps getting better. So there's all these other things that keep getting better long after your weight has actually stabilized. And so when you hit this point, it's even more important to talk about those things, because they're the only things that are actually changing. Weight is not going to change. Right? It's going to stop. Right? And that's the fundamental mistake, that when you start cheering people for weight loss over here, you know one day you're going to have to stop cheering for weight loss because there's not going to be any weight loss anymore. So the more you focus on success, or the more you define success as weight loss, you're going to run out of things to focus on. And I've heard that so often with patients that they say after, I don't know why I'm going anymore. Nothing's happening with my weight. I'm not learning anything new, there's nothing. So the two aspects of that are, if you're doing this in a group setting, there's two aspects. The first one is you try to focus on what else is getting better. So sometimes it's new things that people are doing that they haven't done before. Right, so at this point in time, suddenly this is the first time they've gone to see a movie, which they haven't done for years. Well, that's something you want to celebrate. Right? Or they've actually decided that this summer they want to go down to Mexico, which they haven't done forever. They haven't gotten on a plane. Or they've actually now bought a bathing suit and they think they're going to go maybe start exercising and exercising. So those little things that will happen, those are the things that you're going to celebrate, right? And those were not possible before, but they're possible now. And they'll keep getting better. Right? But you can start focusing, but if you're focusing on behaviors right from the beginning and are looking for behavioral goals, well then really your counseling doesn't change, because there's always new behavioral goals that people will have or reinforce. If you focus on weight, you'll run out of steam, guaranteed. Two things will happen. They'll be disappointed because I'm not where I thought I should be, and nothing's happening in the weight.
So I think we're doing that for the most part, not focusing on weight. So, but how do we reconcile that with the patient who is 100% focused on their weight? And so, like I was saying, we have this conversation, and they're like, but I want to lose.
But I want to lose weight, yeah.
But I'm stuck. But I'm this. But I'm that. Right? How do you reconcile those two?
That's a tough question. Sometimes one approach, again, that we've sometimes seen this is that can happen in groups. So one of the tricks, and again, the Weight Watchers use this a lot, TOPS uses this a lot, is they start as a weight loss group, which then turns into a social group. Right, this turns into a social support group over time. The running group it's the same thing, right? They keep their people, initially it's all excitement about what they're doing. It then becomes a social peer support group. And then people are just going because they're friends that they meet every week and they hang out. And that's where a lot of that kind of thing, that readjustment happens. But, if somebody's totally focused on their weight, that becomes a whole different type of intervention. That's again the all or none thinkers. That's the black and white thinkers. Either I hit my goal or why am I doing this, right? I have one extra cookie and then I follow my entire diet. So and you see that a lot, right? That the need for trying to be perfect. And that's more of a psychological thing, and sometimes it's a personality thing, and then you just can't change it. There's also the 80-20 rule that applies to clinical practice, where you're not going to get 100% of your patients. You're going to get 60%, 70%. That's going to be something. You won't get it, and normally what happens, you lose those patients anyway, but they're not going to be happy. They'll, sooner or later they'll drop out, you'll have attrition, they'll go off Bernstein's, or they'll buy something from the Dr. Oz show, or they'll do something else. I mean, you just can't hold them. And that's the nature of things. You do your job as a professional, try your best. I mean, you're not, I won't be able to help everybody. Does that make sense? Any questions?
There's strategy for that from the whole eating disorder. Because it's almost a kind of eating disorder then, right? It's almost
The
a
focus,
perception on body image.
So I don't know, I'm not an expert in eating disorders. I know that there's a lot of, so in the emotional eating groups that our psychologists run, there's a lot of talk about this. There's a lot of talk about shades of gray. And that you get away from the all or none, black and white. You see the perfect or not. You know, I have a goal of 40 pounds, and if it's only lose 38, then I failed. That's so. This focus on numbers, focus on being perfect, and it's constantly there. And not everybody, fortunately, but there are techniques to do this. I'm not the technique person. I don't do those conversations, but eating disorder people have that. And the emotional eating stuff. So it's a recurring theme, right? Some people are just not going to. They're always hoping for the magic pill. They're always hoping for. One of the main things that people always think is that, you know, if I can get here, then I can get here. And that is often probably our fault, because we always, when we read, you know, when you read your textbooks and literatures or listen to people talk, they say, oh, you need to lose weight slowly, so you're losing 2 pounds a month. Well, it's only 2 pounds a month in the first month. The second month, or 2 pounds a week, right? So it's only 2 pounds a week in the first couple of weeks, and then that's going to slow down. Then it's only 1 pound a week, and then it's going to be half a pound a week, and then at some point it's going to be 0 pounds a week. But it's not going. You're not going to continue losing 2 pounds a week over the next 100 weeks till you've lost 200 pounds. But it's not a cumulative thing. It does not continue at that rate. And so often I see it presented like that. I always see this presented as, here's how many pounds per week. And then they're doing the math. So, okay, that's great. So 10 weeks I lose 20 pounds. Perfect. No, that won't happen. Why? Because by the time you get to 10 pounds, you're no longer losing 2 pounds a week. But the same amount of effort, and that's the frustrating piece, right? That you're doing the same amount of effort. In fact, if you look at the physical activity part of it, it gets harder and harder. It doesn't get easier and easier. That's unfortunately, right? Because the longer you restrict your calories, the more you're going to actually have cravings, and the more likely you're going to fall off, especially once you hit a certain threshold where your calories have come down to a level where really you're hungry all the time. That becomes so much harder maintaining that, and the chances of falling off are so much higher. And the activity levels have to continue increasing. So when I start exercising and I'm big, there's at least 4 or 5 mechanisms why, as you start losing weight, your exercise levels have to step up. One of the most obvious one is, of course, you're no longer carrying the weight. So if I'm walking 10,000 steps at 200 pounds, now I'm 150. Well, I'm not carrying those 50 pounds anymore. But so if I walk the same distance, I get so much less exercise because I'm no longer weightlifting. But that's only one mechanism. There's other mechanisms. As a consequence of no longer weightlifting, what's the other thing that happens? I lose muscle mass, right? So by losing muscle mass, my resting metabolic rate drops, right? So losing weight, just for that mechanism alone, already I'm burning fewer calories. Then on top of that, there are the physiological adaptations. So there's a huge fall in sympathetic nerve activity as I lose weight, which is part of why blood pressure comes down, right? High sympathetic activity stimulates brown adipose fat, which burns calories, right? So I lose that. That's the single most important reason why people feel cold and they lose weight, right? Normally when it's cold, your brown adipose tissue is generating heat. And that's a function of sympathetic activity. When you lose weight, sympathetic activity drops, that no longer happens. So people who've lost weight feel cold. You can always spot them. So when you see somebody wearing a sweater in the summer, they're either anorexic or have lost weight. They're cold, they're physically cold. Right? They're burning fewer calories. And
Or they move.
or they move to bacteria. And the third mechanism in this, and this is the really scary one, is actually that your muscle, your skeletal muscle gets much more fuel efficient. And that has to do with changes in mitochondrial function and the, sort of the energy coupling that happens in your muscle. So as I start losing weight, I can do the same amount of exercise or the same amount of effort with far fewer calories. There's a huge drop in calories for the same amount of activity. Right? And so activity has to keep ramping up. If you still want to burn the same amount of calories in that exercise, your level of activity has to almost go up exponentially. Right? So that's why I say you can lose weight by running 5K every day. If you keep it off, you have to run 10. Right? And it's a self-limiting because of all of these physiological changes. Right? And so there's no way, there really is no way beyond this, unless you want to do something more drastic. Right? More drastic is more effort. Okay, any other questions around this? Any problems with the assist phase? Pretty clear what's going on there? Yeah? Okay. Any questions? Any comments? Anything you want to ask? Chance to ask?
I'm just going to say that diagram is, to me, a fabulous little teaching tool. It says so much, like what you just said, all in that little diagram, and I was wondering if we could just even have a little diagram of that to show our patients. Or maybe I just have to draw my own.
No, we'll make you one.
Yeah, it just seems like, something you could pull out and sort of explain and kind of well encapsulates the message. Yeah, or something like that, yeah.
So with us today is Patrick, who has been kind of our tool developer, and we're trying out a 5 A's card game just around facilitating conversation around the A's. We're going to break into our normal 2 groups and do that, but Denise and Arya thought it might be a good idea to maybe do like an example.
Yeah, before that we should probably just